My statement is COVID vaccines are safe. COVID vaccines save lives. With technology, with science, with the commitment of scientists, we have a vaccine that has been developed very safely, very effectively, in the shortest possible time in human history. This vaccine would not have been available for us here today in Uganda without the commitment and the generous contributions of the members of the COVAX facility. These are countries, these are institutions, these are individuals who took upon themselves the responsibility to make sure that access to the COVID vaccine is equitable. It reaches everyone around the globe at the same time. It reaches us here today. So on behalf of all of you, let me thank them directly and thank them through their representatives who are sitting here from different embassies and international organizations. COVID-19 impacted humanity in a way that we did not experience almost for the last decade. Millions of human lives, loved ones were lost. Schools were closed. As I speak, more than 332 million students are unable to go back to their classrooms. And here in Uganda, around 15 million students are unable to go back to their classrooms. But that was not all. Economies were impacted in a very severe way. Global economy, national economies are struggling to recover. But amid all of this pandemic, we saw some light or lights. We saw the commitment of the medical personnel, of the health workers around the globe, putting their own health, their own lives at risk to save us, to save all of you. Today, I salute them all. Today, I pay a tribute to those who lost their lives in the line of duty. Uganda has been one of the first 10 countries in Africa to receive the COVID vaccines from the COVAX facility. So thank you very much, and thanks to everyone who has worked tirelessly to make this possible. Again, I would say, ladies and gentlemen, COVID vaccine is safe and it saves our lives. UNICEF has been a member and will continue to be an effective member of the COVAX facility. On behalf of the COVAX facility, UNICEF has secured 2.2 billion doses of COVAX vaccines. The first shipment has already arrived here in Uganda, and UNICEF, on behalf of the rest of the COVAX facility members, will make sure subsequent shipments of vaccines will reach the country very soon. The plan is to have more than 3 million doses of the vaccines from COVAX facility arriving here in Uganda by the end of May. So once again, I would like to congratulate all of you on this very remarkable historical day.
Let me repeat our motto. COVAX vaccines are safe, and COVAX vaccines save lives. And until we're sure that everyone equitably receives the vaccine, the world will remain a hostage for this virus. This is a day where we know that we are starting to win on this virus in a big way. This is the day that all the effort the health workers have put and the frontline workers have put 24 hours a day, 7 days a week, and the last more than 365 days is starting to bear result in a big way. This is not to say that the health workers has not done, the frontline workers has not done their job. They have been able to keep us safe up to now. But with this new tool, their effort will be long-lasting as well. As my colleague, the UNICEF representative, has said and explained a lot, I will not go into more details. He made my life easy. So I will deal with only two issues. One is to explain to you how we reached here. In the middle of last year, we realized that this new virus is really difficult to deal with if we have to bring in new diagnostics, new therapeutics, and new vaccines. So a movement was created known as the ACT to accelerate these three branches of tools be available for everyone in an equitable way. And part of this, the vaccine component of this act is known as COVAX. COVAX was initiated and coordinated by CEPI, Gavi, and WHO, and UNICEF has been a partner to ensure that we have the vaccines. The COVAX facility, with support from governments, intergovernmental bodies, philanthropic organizations, have been able to fund the development of vaccines. And one of the vaccines which this COVAX facility has invested on is the Oxford AstraZeneca vaccine. And there are others. By the way, there are more than 279 vaccine research going on as we speak. And 74 of them are in clinical trials. Although only 2 of them have the emergency use licensing from WHO, and two other vaccines have been also licensed by major regulatory authorities. Currently, there are almost 300 million people who have received these vaccines, and we haven't seen any major adverse effects, very rarely only. And that is a proof that these vaccines are safe. These vaccines have also already started showing how we will open the economies, how we will go back into the normal situation as we know it, although it might be a bit changed. And as already the UNICEF representative has mentioned, already over 2 billion doses of these vaccines has been secured, and the aim is that this COVAX facility will ensure 20% of any country is vaccinated before the end of the year. In addition to that, governments, philanthropic organizations, international development partners are also invested in ensuring and supporting countries to go beyond the 20% so that we can reach a global herd immunity. And that is going on, and I would like to congratulate the government of Uganda for committing already to increase beyond the 20% to 40% by investing additional fund from the government by procuring 18 million doses. Thank you. Your contribution is not only for the Ugandans. This making sure Ugandans are safe is also a contribution to the global safety. These vaccines, before they are licensed, go through a rigorous regulatory processes. The research are examined again and again by independent researchers and institutions. It is only after that this vaccines has been made available for the public. And it is important that everybody gets vaccinated. Every eligible person gets vaccinated. And the reason is two. One is the sooner we reach there, the sooner economies and social services, education, everything will get to semi-normal or normal. The other is this virus is one of the fastest changing virus. Various variants have started coming up. And the more variants come, the more it will be difficult for the vaccine to be effective on all the variants. Currently, this vaccine is effective for all what we are having, and it is also good for anybody above the age of 18. And it protects, ensures that the person who is vaccinated does not have severe disease and do not die from this disease. But to ensure that the virus does not mutate into another form which is difficult to control, we have to deprive it of its capacity to multiply. And that we can do by making sure that the vast majority of our population is vaccinated. So beyond protecting yourself, you are also protecting your neighbor, your loved one, your community, your country, and in a way, you are protecting humanity. So please be vaccinated. And it is obvious that the National Immunization Advisory Committee has given us guidance. The Vaccine Advisory Committee has given us guidance on the prioritization. And it was a globally agreed priority that health workers should be the first one to be vaccinated. And I thank those who have volunteered to show that it is safe. Senior doctors, senior officials who are here to dispel these rumors that the vaccine may not be safe. It is safe. And this, all of you coming here, is a proof of it. Thank you very much.
That to be here, to be in this event. First of all, because if we go back to last year, March, we can see that Uganda has an outstanding track record in fighting corona disease. And we remember the first months, the measures kicked in, the decisions were taken by the government on restrictions for all of us. We had to stay home for a while, no private transportation. So some people were questioning, is this the right way? Well, I think that history has shown that this was the right way. That this is a country that has listened to the scientifics, to the doctors, medical doctors, and how do you call these? The people specialized in pandemics. So this country has listened. You know that the president several times has mentioned that in this crisis we need to take the advice of the scientists in several of the speeches. And that is what this country has done. And the results are there. I remember that back in June or July, we, as diplomats here in this country, we developed some social media campaigning material to show the impact, the positive impact of the measures on the numbers. I shared that with the minister back then. And so we were convinced from the beginning that this is the right approach, and we still see that today. So we are happy to be here in a country that has listened to the scientists, that has really taken up this challenge and put forward excellent results, not only in the world, but even in the region here. If you compare with many other countries in the region, I think that Uganda really stands out. The same is the case with this campaign, the vaccination campaign. And you know that all of our countries here in this event, we have contributed, some modestly, some not modestly, in some way to make this happen, to make the vaccines arrive here, together with the UN. And I want to stress the importance of UNICEF and of the World Health Organization, our friends who are here, in what they did to make this happen, to coordinate, to organize the transportation, the conservation of the vaccines in the good conditions, and everything that is needed to be done in order for this to happen, for this vaccination campaign to be launched today. So happy to be here and happy to be one of the countries with a contribution in making this happen. Because this is not only the result of a government, this is the result of international cooperation. And that is what we stand for as diplomats. So we want to promote that international cooperation. What we do, what we try to do here as European and other countries in Uganda is to help the population, to help the government, help the population to fight diseases, to improve the health, improve education in all fields where we are active. And so that is a privilege to be here today in this event. Now, to underline what I mean here, that we really have this belief in what Uganda has been doing and what Uganda will continue to do, we will stop using words today. We will not speak anymore about these things. We will change to body language. We will use our body to show the confidence we have in this campaign. Some of us will get a jab today. Ambassadors will be vaccinated with the Ugandan vaccine upon the invitation of the government, because we are in one of the categories. So most of us are above 50. We don't look like it, but we are. And so we'd be happy to express our confidence for one time as diplomats, not with words, but with body language. We'll take the jab and shut up. So thank you for inviting us here. And I hope that this campaign, that our example also can show the people that this is really the way to go. Because the vaccination is not for yourself in the first place, it is for the people around you in the first place. It protects the people around you. It protects the Ugandan population and everybody here you meet and you encounter. So I hope that this can set an example and that the whole population of Uganda above 18 will participate in this vaccination program. So thank you very much, and looking forward to that jab. Thank you.
Thank you very much, Your Excellency.
I want to thank the scientific committee, that's our scientists that have been sitting. I remember these meetings that whether Easter, I remember even on Easter Day, we were meeting. I remember that the scientists would not even say today is a Sunday, today is a public holiday. They would always be meeting. And I want to thank you for your guidance. And I think we have come this way and this far because of your guidance. We value your commitment. We value your sacrifice this time. I can't count how many meetings we have had with you, and you could not, you put aside your work, and you are always with us. And I think your guidance has helped this country so much. We are being applauded, Honorable Minister, but I know that this effort, it is not just the Minister of Health alone. It is such a combined effort. Big effort. This time around, we just felt the warmth of love, of care, of humanity in this country from every corner. The private sector. We want to thank the advisory committee and the members you put there. The private sector, I know that Kabushenga is seated there, Bitature. These are people who have been in trenches with us. We want to thank you so much. And take our appreciation to the entire private sector that has been working with us. To the donors and development partners. World Health Organization representative has elaborated the COVAX facility and how it has started. Without the donation and the support of individual countries in the midst of the COVID, when even all the individual countries were facing the pandemic challenge, but the countries donated and created this COVAX, and want to thank you so much. We want to thank in a special way UNICEF and World Health Organization. These two agencies, they are not like UN, you know, they are they are part of Ministry of Health, because whether night, whether Sunday night, they are in meetings with us. So we really want to thank you so much for the dedication and commitment that you have really shown to service. To our staff, Ministry of Health, words cannot express what you have been to us. To our clinicians, to our medical workers, ranging from consultants to junior doctors, to nurses, to laboratory, to radiologists, to all the team, including cleaners in these hospitals where COVID patients were being treated. We owe you so much. We cannot say thank you. Thank you is not enough. But we want to tell you that your contribution is so valuable. We value you, we appreciate you, and want to say that you are the reason we are here. And want to say we are proud of you, and we can assure you that we shall go and we shall win this battle. Where we are to witness this vaccine, we did not know. In March last year, we had no idea that would be here launching this vaccine. But we are here because you have saved lives. I want to thank Mulago Hospital and Entebbe and the regional referral hospitals where our patients have been, that they bore the whole pressure of the country at the time we were really, really going through hard time. We want to thank you so much for bearing that weight. And you have shown capable and able and efficient and effective. Thank you so much. We know every life matters, but we cannot access all the vaccines at the time, and that's why we had to go in phases. But I want to tell you that as a country, as government, as Ministry of Health, we want to thank you and want to say we shall get everyone to receive. There are special agencies, National Drug Authority, thank you so much for quick and expeditious approvals that we received in the country. We want to thank national medical stores that were already in the trenches delivering all the vaccines in all these facilities and making sure that the integrity of our vaccines remain intact. Thank you so much.
In the absence of very effective treatment options and low adherence to the known public health and social measures, COVID-19 vaccination is the game changer in the response to this pandemic. We now know that COVID-19 vaccines provide the most potent means to save lives, prevent severe forms of the disease, thus protecting the health systems from congestion, reinvigorate livelihoods, and enable the full reopening of the economy. Uganda now joins the rest of the world in the race to vaccinate at least 49.6% of its population. That's about 21.9 million people, including the refugees, with the COVID-19 vaccines in a phased manner. Each phase is planned to cover 20% of the target population, which is about 4.4 million people. The eligible population lies in the age range of 18 years and above. In the context of global pressure on vaccine stocks, the priority persons to be vaccinated is guided by the occupational risk of infection, the risk of developing severe disease, death from COVID-19, and population characteristics, including age, gender, and geographical location. Therefore, phase 1 of the vaccination will focus on health workers in public, private, not-for-profit, and private for-profit facilities. These are estimated at 150,000, including the support staff. That is what health workers mean. It will also focus on security personnel, the UPDF, police, and prisons, estimated at 250,000, and these have been at the front line, as you all are aware. We'll also focus on teachers, both in public and private facilities, among other essential service providers, and they are estimated at 550,000. Persons from the age of 50 years and above, who are estimated at about 3.3 million persons. Persons with underlying health conditions aged below 50 years or from 18 to 50 years, estimated at 500,000. And other emerging high-risk population priority groups, including the airline workers, the media, prisoners, tour operators and guides, bankers, immigration officers, the Wildlife Authority, Revenue Authority, humanitarian workers, and others who will be identified by the Vaccine Advisory Committee. We may not have adequate vaccines for all these people at once, but as the vaccines come in, we shall continue to prioritize them. In phases 2 and 3 of the COVID-19 vaccination program, the ministry will roll out the vaccination program to age groups between 18 and 50 years of age in a staggered manner until 49.6% of the Ugandan population is vaccinated. This exercise will also be guided by the local epidemiology of the disease. Right now, our chief guest, Ugandans are assuming that COVID is no longer with us. But the people in the isolation unit in Mulago can testify that we are still getting cases, and some are severe and they are succumbing. And so I want to remind Ugandans that while we reached our peak and plateaued and dipped, there is a likelihood that we can go into the second wave of the pandemic. And therefore, it is important to remain on alert and take care of your health. As we launch the COVID-19 vaccination today, the first group to receive the vaccine are our dear health workers. All health workers from public, private, not-for-profit, and private health facilities will be the first group to receive the vaccines. This is because they are at the front line, as you have heard from the various speakers, in response to the COVID-19 pandemic and are vulnerable to infection, as has been shown by the statistics of infection. We have over 1,900 health workers who have been infected by COVID-19, 19 of them succumbing to death. It is at this point that I will humbly request all of you to stand up for a moment of silence as we remember. May their souls rest in eternal peace. Please take your seats. I also appeal to all eligible persons to turn up for vaccination and complete the 2 doses, which will be 8 weeks apart. If you don't complete the 2 doses, then you will not get the immunity that you desire. I also encourage the general public to resist spreading rumors about COVID-19 vaccine, which are unfounded, which are baseless. Always verify your information with the Ministry of Health, with the Vaccine Advisory Committee, or with the Scientific Committee before you continue forwarding to everybody to scare people. Take heed, vaccinate against COVID-19 when your time comes. The vaccines are safe and they save lives. Thank you all for listening to me.